Getting vaccinated means that you have a lower risk of contracting COVID-19, suffering severe symptoms or spreading the disease to other people. But it may now also save you on your insurance premiums and even give you freedom to enter certain countries with a vaccine passport. Well, the big debate is this discrimination, or is it simply encouraging the preservation of life? To answer this, we're joined by public health lawyer Safura Abdul Karim. Thank you so much, Safura, as always, for joining us. We love having your insights here on the show. There's so much debate going on about mandatory vaccination. Let's just get this clear from the upfront. Nobody's going to force you to have a needle plunged into your arm, but you could face consequences should you choose not to. Safura, just switch on your audio for me, please.
Apologies.
Hi, no problem. Let's start from the beginning. Off you go. Thank you.
So there is, at this time, some limited legal infrastructure which would allow certain individuals to be compelled to take a vaccine. And if you don't agree after a court has ordered you to take one, then you could face imprisonment. But that's a very, very, very small niche type of arrangement. For the most part, it's exactly what you've described, Annika, which is there's going to be a whole lot of incentives to encourage people to get vaccines, and there's going to be a couple downsides if you choose not to get a vaccine.
Safura, in France, there's been quite an outcry about this Macron's pass sanitaire, where there have been marches. You need an electronic vaccine pass in order to enter restaurants, bars, cultural venues, and care workers will need passes by September, or they can be suspended without pay. Do you see anything like that happening here?
I think the big difference between us and many high-income countries that are beginning to implement something like this is actually around vaccination coverage. So because we've had a very limited number of doses, although much more than the region, we still have very low numbers of vaccines available, and we haven't reached a kind of coverage where something like this would be fair. In countries where they have 80–70% coverage, it makes sense to introduce these types of measures if you're trying to incentivize the remaining groups of people to get vaccinated and to preserve the integrity of your healthcare system against COVID-19 infections.
What about insurance premiums? Some insurance companies are already offering their clients lower premiums if they're vaccinated.
If you think about it, it makes quite a lot of sense logically that an insurer would want somebody to be vaccinated because the cost of care for severe COVID is very high. So it does make sense, and insurance companies can change the terms of your insurance and what's covered unilaterally. However, there is a possibility of this being challenged on the basis that it's discriminatory. Remember, there are some groups of people who cannot get vaccinated for health reasons. There are some people who cannot get vaccinated due to religious, social, and cultural beliefs, and there are some who just have who are fine to be vaccinated. And it's very careful to treat. We have to be very careful to treat each of those groups differently because they're not all the same.
So many people are asking me on a daily basis, as an employee, do they have to get vaccinated? Can they be fired? Or can I fire my employee or tell them not to come in should they not wish to be vaccinated? Am I right that we're still in uncharted territory here, and we probably need a test case to go to the Labour Court and then the Constitutional Court?
That's quite accurate. Although the current employment legislation imposes a burden on employers to create a safe and healthy working environment, it's unclear whether or not employers can compel somebody to take a vaccine. Like I mentioned, there is infrastructure that allows the government to do it. Whether employers are allowed to do it it could be subject to challenge. Overall, the idea of mandatory vaccination in South Africa has been considered constitutional, but when it comes to an employer deciding to do it, it's going to depend a lot on the employee's risk, the availability of vaccines, and a multitude of factors. It's not a straightforward issue.
When you're talking about government, do you mean civil servants?
What I mean is where a government official has determined that somebody needs to take a vaccine, and that can be in terms of the Disaster Management Act, or it can be in terms of the National Health Act. Now, what sorts of people are subject to that is a bit of an uncharted territory. We've only seen it done in the case of yellow fever vaccines, where somebody travels to a yellow fever risk zone and they come back into the country, then they are required to take a vaccine. We have seen this legislation used to, for example, keep people who have XDR-TB in quarantine. But what sort of person has to be vaccinated, that's a question mark.
Last question. Do you think that we're going to head towards electronic vaccine passports?
I think that it's entirely possible that the entire world is going to move to that. And that might be something that's implemented by the World Health Organization in terms of the international health regulations. It could be a regional arrangement like what we have with yellow fever. And it will be for South Africa to determine how we implement that locally. Whether it's going to be electronic remains to be seen. The yellow fever vaccine is still a piece of paper. So it may be that your card that you get when you're vaccinated is good enough.
I mean, it's could be a little strange. My card's quite big. Folding this big card and tucking it in your pocket to, in order and putting out this crumpled piece of paper to go to a restaurant. An electronic pass certainly does make sense, but it's going to take some logistical effort from government, I should think, which I don't know if they're ready for that yet.
Yeah, I mean, the additional complication, of course, is that this is very sensitive personal medical information, and we've just had a new personal protection of information regime introduced that's adding a whole different layer to whether or not people can have access to this type of information and under what circumstances. So it's definitely not something that we're going to be seeing rolled out next week or next month. This is something that's going to have to happen over a long period of time.
Thank you so much. Safura Abdul Karim, she is a health lawyer, public health lawyer, and she's really at the forefront of the vaccine drive and how it's going to be tested in our courts. Well,